Things all here. So I gotta have to figure out how to show you guys the little peeps because the little peeps are now pretty big peeps at like 4 weeks old. Kind of amazing. They're getting thank you, Joanne. They're getting part of your morning habit stack. Thanks, we appreciate it. Um, they're getting big, so big, in fact, that they can jump out of their big plastic tote if the wire is not covering them. I'm desperate to move them out of our bathroom because the dust and the little tiny feather pieces are everywhere. It's a mess. I don't even like leaving our towels hanging in the bathroom because everything is covered with dust. I really thought we could move them out to the barn this week, but it's even though it's going to be warm all week, next Sunday or Monday it's going to be 39 again in the morning, and that's just too cold even with their light. So, peeps in the bathroom. Peeps in the bathroom. Uh, don't like daylight savings time for you. It's 5:30 in Arizona. Oh, jeez. I love daylight savings time. Let me just tell you, I love it. Staying light till 7:30, 8, 9. By June it'll be 9. It's awesome. So I can have much longer days and get some work done and go play. Anyway, okay. Um, I got a panic text from a friend in Pennsylvania yesterday who was a client when I was up there. Her little Shih Tzu was very agitated, doing head shaking, and had rapid back and forth eye movement. And so she sent me a text. She said, "Is this an emergency? Do I need to go to the ER? What's going on?" And so I watched the video, and yes, the dog was kind of doing this, and the eyes were moving. And I said, "Well, that looks like a vestibular syndrome problem, which we see in old dogs. Usually, you'll see a little bit of a head tilt, they'll be off balance, they're falling over. Really severe ones can't even stand up. But really, the hallmark for it is you get this rapid eye movement back and forth. It can be up and down, but it's almost always back and forth. Um, and I've some people, some patients I've seen where they get a head tilt and they're falling, but they don't get the rapid eye movement. So when we see this, it's can only be a couple of different things. It could be a brain tumor, but usually don't see a sudden rapid onset like that. You usually see other symptoms. It could be an inner ear infection because your inner ear is your balancing apparatus. So I think the ones where I don't see the rapid eye movement, but I get a head tilt and they're falling, that's more likely to be an inner ear infection, although you can't know for sure without an MRI or a CT scan. Um, and then the third thing is old dog vestibular syndrome. And the vestibular syndrome, we don't really know what causes it. It's the closest thing that we have to a dog having a stroke. Cats can do it too, just not near as often. Having a stroke like we would think in people, but it's never really been thought that we should be putting them on blood thinners or anything like that. And a lot of times it's a one and done situation. The great thing about it is that within 48 hours, it is usually self-correcting. So if we don't panic, and as long as the animal is stable enough that they can eat and drink, and they're not doing damage to themselves, the ones where we have the most trouble are those who are so off balance and so tilted that they're nauseous from it. If you think about it, it's kind of being seasick. If they're vomiting and can't hold down water, the food's not even that important, but if they can't hold down water, you don't want them to go 48 hours without being able to keep water down. So that would require uh, an emergency visit. So I told her to give the dog some CBD. She had some on hand, and then she sent me an email with a picture of the little dog sleeping, very calm, very comfortable. The CBD did a great job for her and calmed her down. I haven't heard from her yet this morning to see how we're doing today, but most of them it is self-correcting. Some of them, if they were really bad, they'll be left with a head tilt, so they kind of walk around corners all the time. But most of them, the rapid eye movement will stop within 24 to 48 hours. Some of them even faster than that. Some of these guys, it's a flash in the pan. They've got a bad hour and then they're back to normal. Others, it'll be a couple of days. I think the worst cases I've ever seen 4 to 5 days, maybe require hospitalization for a couple of days on fluids if they're not able to hold things down. But the good news is that probably 95% of them recover with no long-term really bad effects, and they're fine. It's kind of a flash in the pan. We don't know why they do it. So you had to take a week off work. Your boy was so off balance for that week, but he made a full recovery after 3 weeks. Yeah, and that's pretty typical for the really bad ones. You had an old dog who did that years ago, thought she was having a seizure. And that's very commonly what we're thinking that they're doing, because you will get a little head tremor sometimes and they're so off balance. Would that be a double dose of CBD? Not necessarily. Not necessarily. Would ear cleaning help? No. Middle ear is behind the eardrum. So you're not going to have anything on the outside. So years ago, before I studied holistic medicine, stuff that I do now, we used to routinely hit them with antibiotics just in case it was an inner ear infection. I think that's a bad way to play the game now. We would give them steroids just in case it was something inflammatory. And then we would give them anti-nausea medication if they were really nauseous, not eating, throwing up. Over the years, as I learned more and more, I stopped using all those things. The only time they would get anything for nausea was if they were just not able to hold anything down. They would only get fluids if they were not able to hold anything down. I stopped giving them antibiotics because most of them are not an inner ear infection. And we stopped giving them steroids because it didn't. There were good studies on that showed that it didn't make any difference one way or the other if they got steroids or not. So why give them a steroid if they don't need it? So your 13-year-old had one at 7 and never had another. See, that's how do we tell the difference between the head tilt falling and a seizure? Well, a seizure is usually short-lived. The head tilt falling from a vestibular syndrome will last longer than 30 to 60 seconds. Yeah, with your dog it was continuous. So what is food for low hemoglobin in senior dogs? Is nutritional yeast powder good? That would be one thing. Any blood tonics. So organ meat, heart, liver, dark red vegetables, dark leafy greens, things that feed the liver, and things that are blood tonics. So we've got a list of those. Could flea heartworm medication cause that? Any of the chemicals, the moxidectin, the isoxazolines, the Seresto, any of those neurotoxins can definitely cause seizures, tremors, neurotoxic effects. So one of my followers, Carol Shimp, I don't know if she's on this morning, sent me a text first thing this morning. The local newspaper says there's a congressional team calling for the recall of Seresto collars. Well, that's awesome. That's amazing. Of course, it has the picture of the woman who says that her dog died. I think she was in Virginia or whatever. She must be very vocal and making a big splash on social media, because guess what? We've been really vocal about isoxazolines, Brevecto, Nexgard, Simparica, Credelio for, about 5 years now, and no congressional committee calling for that stuff to be recalled, and a lot more dogs have died from that than Seresto. So, anyway. Peter Tobias has an article, I think it's very deep ear issue, sets episodes off. It definitely can be inner ear, but some dogs that have had MRIs, they've seen little infarcts in the brain, just like we see in people. So I think it can have multiple causes. So, okay. Got to go to the farm, got to feed everybody, got lots of work to do today. The workload just never ends. Lots and lots and lots. Your boy had ear ablation after 2 years of problems. Well, we had ear ablation on both ears for Scout. Best thing we ever did for the little man at 15. And then he was very comfortable till 18. Rosanna, there's a blog on my website called Flea and Tick Prevention, Natural Flea and Tick Prevention Revisited. Has all kinds of ideas for things to use that are natural instead of neurotoxins. A glimpse of spring in Wiltshire, England. 11 degrees and sunny, but I think that's Celsius, not Fahrenheit. I hope.